Keeping a close eye on the COVID-19 case count in Hampton Roads.
Dan Kennedy breaks down what areas are seeing a spike in cases and how the region is doing as a whole.
Parts of the country are dealing with COVID spikes. Here in Virginia, it's not nearly as bad as other states, although today Virginia added 1,076 new cases. That is 4 straight days of increases here in the Commonwealth. The moving average bottomed out earlier this month in early October, but it's been on a steady rise ever since. So we do need to keep a close eye on our numbers. Statewide, the percent positivity rate, 5.3%. The governor yesterday said the most troubling area for cases right now is in rural communities in southwestern Virginia. In fact, he singled out Hampton Roads, saying our percent positivity rate is relatively good. And indeed, we see that in the numbers. It's true that all 7 health districts have positivity rates below the statewide average. But for the first time in months, Norfolk is the highest in our area again, 5.1%. And here's the chart. You see, 8 of the last 10 days have had case numbers higher than the average. This is Virginia Beach's chart. It added 75 new cases today. That's the most we've seen in 7 weeks in terms of single-day increases. So we need to keep a close eye on Virginia Beach in the coming days as well to see if this spike is the start of an outbreak or just a one and done. Meanwhile, the peninsula has a 3.9% positivity rate. You know, relatively speaking, 3.9%, respectable number. But even there, cases aren't falling, though they are staying steady here in Newport News. The 2-week moving average back up to where it was back around here in early September. So, as we've been doing since March, we'll work every day to put these numbers into perspective for you, especially as we enter these colder winter months that health officials have warned about. Dan Kennedy, 13 News Now.